Our next summit presenter is no stranger to the work of God nor the Georgia Rural Health Innovation Center. This gentleman, along with several of his family members, were introduced to our center back in December of 2021 when their community-based organization reached to teach, proposed, and were granted resources to provide health fairs, vaccination clinics, blood donation, and health literacy festivals to community members of Edenton and Putnam County. These events serve to meet the significant need in Putnam to address the vaccine hesitancy and educate community members on the COVID vaccine, along with implementing active registration and receipt of the vaccine. This gentleman, along with his brother Cecil, made sure to educate his church members and community at large on the value of both knowledge and health through these events and also on Sunday morning worship services. We know this because several center staff members, including our executive director, Mrs. Glenda Grant, attended and witnessed this in action. It is because of this great work that was done that secured the opportunity for the Faith in Rural Health program to be present in Putnam County. By the works led by this gentleman, none other than Pastor James S. Kilgore Sr., the table was set, and the Edenton community was equipped to be ready as soon as a golden opportunity availed itself. And that golden opportunity was the birth of the Faith in Rural Health program. Highlighted from his biography, Pastor Kilgore, a native of Decatur, Georgia, is the second son of the late Apostle Gus Kilgore Jr. and co-pastor Joanne Kilgore, who continues to be a guiding presence in his life. Both of his parents were immensely instrumental in introducing him to God and encouraging his development of a lifelong calling to the work of the church. He is an educated and hardworking man, having pursued education at Poly Southern Technical College, an associate's degree in biblical studies from Andersonville Theological Seminary, and served as a certified emergency medical technician in the U.S. Air Force for 4 years before receiving an honorable discharge. Professionally, Pastor Kilgore worked for more than a decade at the Ritz-Carlton Lodge in Greensboro, Georgia, and served in various departments and held management positions. Personally, Pastor Kilgore has been married to the love of his life, Tammy, for nearly 27 years, and together they have 3 children. In 2000, Pastor Kilgore was ordained as an elder and later became the assistant pastor at New Life Outreach Christian Center in 2005. Since 2010, he has served as the senior pastor of the same church, and his ministry is deeply rooted in family values, emphasizing the importance of God in family life and focusing on nurturing the next generation. His passion particularly extends to young men and fathers, guiding them to realize their God-given potential. Specifically at New Life Outreach Christian Center, Pastor Kilgore's mission is to address the total needs of mankind, spiritually, financially, physically, and mentally. Beyond his pastoral duties, he is actively engaged in his community, for he serves as chaplain for the Putnam County High School football team, coach of various sports in Putnam and Baldwin counties, and provides service for the Boys and Girls Club of North Central Georgia. Today, Pastor Kilgore will present the Faith in Rural Health, with emphasis on the church's role in rural public health collaborations. Ladies and gentlemen, please welcome Pastor James Kilgore.
Which one are we going forward and back? Okay, this one here. Yeah. Okay. All right. Thank you. All right. Good morning, everyone. Good morning. Yes. The Lord has a sense of humor. I was just here probably about 3 or 4 months ago, here on a college tour with the Boys and Girls Club of America, of North Central Georgia. And we walked in this room, we toured the entire campus, and we're telling the children about attending school here, and would have never known that I would have been back here in a couple of months speaking in the same room. So God has a way. I guess he was just preparing me to be here. He said, get ready for, get used to the atmosphere and everything. But I'm so thankful for being here this morning, thankful for the opportunity to share with you some of the ideas and things that we're doing at New Life Outreach Christian Center in Edenton, Georgia. And maybe, hopefully, this can help bridge that gap between ministry and medicine to keep us going in that direction. Thankful also to Mr. Paul Beard. He's been shouting my name. I get conversations from so many out here that Mr. Beard's been saying this, he's been saying that. I'm like, oh Lord, he's setting me up. I got to be, man, I've got to do really well up here. So, but, this is a wonderful opportunity, though. I just wanted to share some things this morning, and I think for my wife being here with us this morning as well, and she taking time out of her day. She worked here at Mercer University for years, and this was the university that we thought our children would one day be attending, because at that time, if you were an employee, your children could go here for free. That would have been wonderful. But God had another plan. Once again, he has a sense of humor. He has a way of doing things. So, my sons right now, though, they're attending the University of South Carolina, the Gamecocks. They play football up there. So, and the Lord still worked it out. So we don't have to pay for anything. So he still worked it out. So, but this morning, let's go forth in the slideshow here. And my first reference, though, I always have to go back to the Word of God, because this is who I am, and this is what God has, he has put in my heart. And I'm reading from 3 John, the first chapter here, in the second verse. This is the Apostle John, who was of the 12 disciples of Jesus Christ. And he's speaking to Gaius as a leader of the churches in Asia Minor, which is in modern-day Turkey. And he writes this letter, and he's beginning with this. And he says, "Beloved, I pray that in every way you may succeed and prosper and be in good health, physically, just as I know your soul prospers spiritually." This is letting us know that God, he wants us to not only prosper in our spirit, but in our health as well. It's very important. And we play a pivotal role in that as spiritual leaders, as pastors, as ministers. We play a really important role in making sure that our members and our neighborhood and our community know the importance of medicine, taking physicals, doing all type of treatment that is needed, not being so doubtful and fearful. Because I know many times, and when we were growing up, people would say, "You going to the doctor? Oh, they're gonna find something." Well, that's what they're supposed to do, find something. If they can't, you're gonna come back, you're gonna have 3 or 4 medicines and whatnot. I said, no, that's not what it's about. It's supposed to be, that's there for help. And we have to educate ourselves and let ourselves know that. So, and teach that to our people. But faith-based organizations play a vital role in promoting health awareness within their communities and churches. Their influence stems from their strong community ties, trusted leadership, and holistic approach to well-being that aligns with their spiritual teachings. This is a very important part. I want to share this story with you real quickly. I heard a pastor testifying about, and he was speaking about his experience with one of his members, and she was sick in the hospital, being diagnosed with a very serious sickness, and it was a life or death situation. She had to have a procedure. And this goes to the connection that pastors have with their members. And she said, "Pastor, the doctor has suggested that I have the surgery." She says, "But I won't have it unless you say it's okay." That's serious. That's a heavy cross to bear as a pastor. That your member is saying, "Look, at your word, I'll go forth with the surgery. But if you tell me not to do it, I won't do it." And that's when he said he stepped back and he began to see the seriousness, even more so, of the position that God had called him to. And he says, look, he made the decision. I believe she had the surgery and everything was well. But that is the connection that ministry and medicine has. That's the connection that people can reach out to, and knowing that if we can get the pastors involved, we can get the churches involved, we can get the people educated. We can get them to the point where sometimes these situations don't even have to come about because it was caught way ahead of time. A friend of mine right now, his mother is dealing with leukemia. And I understand that. My father passed from leukemia. And that was over 14 years ago. And when I called him, he was stressed, he was upset, but we began to talk and I began to minister to him and we prayed. And he told me some good news. He says, because of what has happened in the last 15 years in medicine, the doctors has given us good news that mom seems she's gonna be all right. But that's the thing about it, that we need to educate the people and let them know that there is help. There is care out there. There is a way. Now, some 40 years ago or 50 years ago, my grandmother was diagnosed with leukemia because it runs in our family. That cancer tries to run in the family. But she didn't have that medicine at the time. All she had was Jesus. Amen. So if anybody know what I'm talking about, all she had was the Lord. And as the doctors told her, said, look, we can only do but so much, because they didn't have but so much medicine and education in those fields at that time. But my grandmother went to a prayer closet and she went to praying. She went to fasting and believing. She went back to the doctor. The doctor says, Mother Kilgore, I don't know what you're doing, but whatever you're doing, keep doing what you're doing, because we don't see any cancer anymore. So I believe and I know that God can do it on either side. He can use medicine, he can use divine healing, whatever it may be, but there is healing. And I thank God for that. For my grandmother, she lived on another 30 or so many years without any signs of cancer. So there is a bridge that needs to be gapped, and education that needs to be shared. But at the same time, I still believe that God can make a way out of no way. But as we go into education and awareness, though, workshops and seminars, this is some of the things that we do in the ministry. Offer educational sessions on various health topics such as nutrition, mental health, chronic disease, management, and preventive care. We can do things as health screenings in our local churches. These churches can be used and converted into so much more than just having our worship and praise services. We need to have worship and praise services, but you have better worship and praise services when everybody's healthy. I'm trying to if you can't finish Amazing Grace because we're breathing hard, then we got a problem. We want to be able to worship the Lord like we want to worship the Lord, all right? So provide a partner or local health providers who offer screenings for common conditions like hypertension, diabetes, and cholesterol. These health screenings are important. The God gave me a health screening one morning, though. Allowed me to do a health screening with the members one morning. And I'm not a doctor, so I'm not trying to claim to be one. So, but we were having altar call, and I was praying for the members, and the Lord just stopped me. He says, I need you to pray for the members that are dealing with diabetes. And I said, Lord, what? Diabetes? And I'm thinking, like, okay, God, since you said it, I'm going to do what you told me to do. And as I begin, I said, now everybody in here that's dealing with diabetes, please stand. Half of the church stood up. I said, Lord, I did not know that. And we have a situation. We have a problem that can be resolved, not just through prayer, but if someone would be educated about eating right, taking care of their health at a young age. These things should not have to happen, that we have so many people dealing with diabetes in our congregation like this. It really hit me in my heart. And I said, this is something's got to change. We've got to do something to divert this, to educate, to do a better work than what we're doing than just standing here, me hooping and hollering, praising God right now. But it needs to be something done. Something needs to be done. So we begin to work on that. And that's what kind of opened up my eyes when I saw that Sunday. That was years ago. And we have so many that are taking a better path now in their health and in their, taking care of what they eat and how they carry themselves, exercise, all of that. We'll talk about that a little bit more in this bulletin here. It says, informational resources, health bulletins and newsletters share information on healthy living, disease prevention, and available health services through church newsletters or bulletin boards. We've got bulletin boards in many of our churches. We have access to so many resources to put out flyers and everything. We put out every fish fry, every revival, we put out every conference. We can do all those things, but we can also put out information about health awareness. We can also put out and have pamphlets available for our people dealing with prostate cancer, whatever it may be, whatever, all the different diseases. We have the access to do it. We just got to get active about it, though. I encourage you all, let's get involved with it. So, but health bulletins and newsletters, we can go online, use church websites, social media, and apps. All of this is possible. All of that's possible through our websites that we have established. That's one thing that COVID forced us into. It forced me into basically learning how to stand before a camera and talk to a camera, because we didn't have anybody in the church at the time when we were going through COVID. So, but learning to do that, it helped us and it got us more equipped to work with Facebook, with YouTube, all of these different other platforms, but at the same time, you can advertise about all our health fairs and everything else that we're doing that is going to help the entire person, not just their spirit. As John was speaking to Gaius about, I want your spirit to grow, but I also want you to be in health. Because at that time, Gaius was over 2 churches and in Asia Minor. He knew that the burden that he was going to have to bear and carry, but you need to be in good health to do it. I don't know if you ever prayed for 20 or 30 people or put 100 people in a line and said, let's have prayer. When you get through praying for that many people, your body is drained. If you remember when Jesus, when he was walking through and the woman with the issue of blood, she touched him. And he said, who touched me? The only reason that he knew someone had touched him because the virtue had been pulled from him. He said, I felt something. When you are praying for some people and you're in there in those services, it's like, it's draining. It's you have to be in good health and be in good strength to be able to do this. My father, one time, he told me, he says, son, preaching for 2 hours is almost like running a marathon. You have to be in good health to do ministry. If we're going to do a work for the Lord and get the gospel of Jesus Christ out there, I'm not trying to get people. I don't know. Somebody might get saved this morning. I don't know. But I'm not here for that. But you never know how the Lord wants to use you. But those areas we're in need. I said counseling and services. Let me go to this here. Offer pastoral counseling or refer members to mental health professionals for support with emotional and psychological issues. We can do that as well. To that point, and some of those mental issues, we need to definitely connect with our medicine world because we're not certified in those areas. We're not called to those areas. God has called those certain people. I believe doctors and nurses have been called into it. It's not just they went to school for it. You have to have a calling for that. You have to have a calling to love people, to care for people, to be there for them. That's more than just I want to have a profession. No, I have a calling on my life, and this is what I desire to do. This is why my son right now is a nurse, because when my father passed, he said he was a child at that time. He was really young, and he was praying for him. He said, I want to do more for my granddaddy. And he said, whatever I can do, if I can go into the medical field and help somebody else, then I'll do so. So those are very important pieces there. But that mental health, we can direct them to the support groups that are needed. We can facilitate support groups for issues like addiction, grief, or chronic illness, providing a space for members to share experiences and support each other. Through the mental cases and everything, I tell the people in the church, many times when they come to church, they're getting a word of hope. They're getting a word of encouragement. They're getting a word that they can make it. So they're in the doctor's office right there anyway. And God is blessing them right there. But there are some times they need more than that. They may need, amen. Some people say, no, I don't believe in they need to take medicine and this and that. But there are cases that need to take medicine. And that's where we come from. And I know in our faith organizations, many times people will say that you don't need this and you don't need that. But God made all of that. All that medicine and everything that's being poured out of the earth, that is what God made from the beginning. So there's already a connection between medicine and ministry. Everything that medicine uses, it comes from the Lord. It's He that has created us all. So, all right. Let me move on. Physical health assistance. They're going to say, no, we can't have him back. He's preaching too much this here. Provide guidance on lifestyle changes such as weight management and exercise, offering and incorporating spiritual encouragement. We have to do that. We got to get these exercise classes. We have a class going right now at New Life. The sisters have changed our sanctuary into an aerobics room. So they're in there on Saturdays having classes. They're in there exercising. They're sweating, getting it in. So on Sundays, though, when I tell them, say, get up and praise the Lord, I know you don't have no excuse because I know you can move. I've seen you in here. You've been doing all this jumping around. Let's do some praises for the Lord as well. But we encourage that using our different buildings for different other resources and making sure that they get a chance to know what it means to go for a good walk. to drink water, to not eat certain things. And these things are being taught also in those health awareness classes and those exercise classes that we do participate in. Now, referral services connect members with local health services and resources, including clinics, nutritionists, and rehabilitation centers. All of that is possible through our local churches. We can put out that information, let the people know about our local hospitals and the fairs that they put on, all of the help that they have. We have in our ministry, one of our local nurses is in the house this morning. That is Sister Charlene Swain. I thank God for her. She is wonderful. She's worked at Putnam and all over Putnam. She's from Putnam County there. And she is a powerful resource in our ministry. She's always giving us information of what's happening in our local area, what the medical field is doing, what vaccines are being offered, if they can get flu shots, all of this type of information she's bringing to the church, and I'm so thankful for her. And health partnerships, collaborations, partner with local health organizations, again, hospitals and public health agendas, agencies to expand the reach and effectiveness of health initiatives. Volunteer programs encourage and organize volunteer opportunities for members to assist in health-related outreach programs. We need all the volunteers we can get. Let the people know that we need help in these areas as well. They don't have to just come and volunteer to teach Sunday school, but they can come in and incorporate Sunday school with information to our young people as well about their health. And we can have sessions as well while we're having Sunday school. We can talk about Daniel in the lion's den, but we can also talk about what it means to eat and have a healthy plate. So I get a lot of that from my background with the Boys and Girls Club. We teach that too. We have a program they'll call Healthy Habits, and we're teaching them to have a healthy lifestyle of what it means to eat a nutritious meal, because a nutritious meal does not consist of hot Takis. I saw this during our summer months, and we were doing breakfast, and we had breakfast and everything lined up with them through a group that gives us food every morning, Happy Helpings. I thank God for them as well. But I see the children walking in with a soda and hot Takis. I said, that is not the breakfast of champions. You guys, I don't know what mom is doing, but we should not be eating that for breakfast. But those are things that I know and areas that they need to be taught and they need to be educated upon. So now, integrating faith and health, spiritual care emphasizes the connection between spiritual well-being and physical health, promoting a holistic approach to wellness. Faith-based health initiatives incorporate religious teachings into health programs, such as using prayer and meditation as a tool for stress management and emotional health. Prayer is one of the most powerful things that I know that can bring peace. And we can help in those areas as well as from our clergy and from our churches is teaching our people about the peace that is involved in prayer, and as well as connecting with our doctors and praying with them. Doctors need prayer too. Nurses need prayer too. I heard Dr. Scoggins when he was saying that the doctors were being ministered to by some of the chaplains there at the hospital. It's important. I remember during COVID when those people were outside, they had been under so much stress. And I remember seeing one nurse, she was in tears. And she said, I just can't take it anymore. She had seen so much death. She said, I just can't take it anymore. But she was outside as well, praying, and she was singing. She was trying to find comfort. There's comfort, amen, in the word of God. There's comfort in prayer, and we need those times to work together as a team because they need that encouragement as well. Doctors, they're going through that. They're carrying a heavy cross as well. They're dealing with situations and issues, and when we come up with these different viruses and diseases that they may not even know what the cure is and how to handle all of that. But through God, through prayer, we help one another. All right? Youth engagement, family health programs. Develop programs tailored to families, including parenting classes and family fitness and activities. Offer health education and activities aimed at children and adolescents, promoting healthy habits from a young age. Like I was saying before, it's very important that we work with our young people and begin to teach them at a young age what it means to eat healthy. One of the things that my son told on an interview, and he was telling the guys that were asking him, how did he get to be so good in football and how did he stay in shape? And he told them he's an All-American He's a freshman All-American last year at South Carolina, and he's doing very well this year. And he told the young guys on the interview, and he was telling me, he said, look, the home-cooked meals my mom cooked went a long way. She made sure that we didn't have a whole lot of sugar. We had a balanced meal. It gave me strength. When my friends when they were giving out in workouts and everything, I was still pushing and I was still going because of what we ate. My wife is the police. She's a health police. She's a health police. Lord have mercy. Put that down. You don't need that. That got too much sodium in it. That's got too much sugar in it. She's reading every label. Now she's walking around the house. She's got this app. Yes, Lord. I said, where do you get this app from? She says, the app, this is what the app does. The app, it reads the ingredients on the different foods or whatever, and it reads it, and then it'll tell you if it's good, bad, or poor. So she just happened to go around pointing at all my stuff. And I said, hold up. Yeah, all of my things I like to eat, that's poor. You don't need that right there. You need to get this here. And she went and brought me this other tea, and I said, ooh, that doesn't taste good. She says, but it says it's excellent, so you need to stick with that. So anything with more than 10 grams of sugar, it doesn't go in the house. So she's on top of it, and it's great, though. We've been able to live and have a healthy life because of these pieces that have been put in place. And many children that I deal with on a daily basis, like I said, the Boys and Girls Club, they never get that, though. They never understand that. They don't understand that, I can't sit down because I got all these Fruit Loops in me. Amen. I've been eating all the wrong things. These Pop-Tarts, my wife threw Pop-Tarts out probably about 10 years ago. She says it's too much sugar in that Pop-Tart, so she put it out. But you still have children that are eating all these different type of things, and people say that one case or another, it's this or that. It may be this disorder, that disorder, but sometimes it's just what they're eating. And we have to address those issues, and our local churches can help in those areas, because they may not listen to the doctors, but if Reverend Williams said it, they might listen. They may take heed to it. And if enough voices are speaking the same thing, hopefully we'll see change. So by embracing these roles and responsibilities, faith-based organizations can significantly impact the health and well-being of their communities, fostering a healthier, more informed, and supportive environment for their members. A healthier member, both spiritually and physically, can have a greater impact in helping spread the gospel of Jesus Christ. Thank you for your time.
Don't sit down.
Okay.
Reverend Kilgore, it's delightful to hear you, and thank you for resisting the urge to preach all the way, but I appreciate it.
Try.
You would be welcome back anytime. We do have some time for questions, and I do believe that the things that Pastor Kilgore has brought up are things that we can really discuss. Are there questions or concerns, thoughts that you would have for Reverend Kilgore? And please, again, introduce yourself.
Okay, I will just say.
Yes.
My name is Linda Frazier. I work for the Department of Public Health. I'm at District Number 7 in Columbus, Georgia. Well, Pastor, you clicked on every click that I am a part of. I'm involved in the faith and wellness ministry at the health department. They have a faith and wellness ministry. I'm involved with the churches in the community, and I go out to the churches and do exactly what you're saying. I'm teaching them about diabetes, hypertension, hypercholesterolemia. People don't want to hear about the obesity part, but they don't want to stop eating what they eat. But that's a part of health and wellness. Mm-hmm. I'm involved in my church because I'm a pastor's wife. All right. So all of those things, I was just clicking with what you were saying. But here's one thing I'd like to point out. Prior to COVID, I don't know about your culture, but in my churches, that I'm an AME. in our churches, we weren't so interested about health and wellness so much prior to COVID. Then after COVID, we jumped on the bandwagon. And what has been really hard for me, and maybe you can help me with this, because you seem to be very enlightened about health and wellness. How do you get the pastors involved? They're not, they're not on the bandwagon as hard as they should be. They should be coming hard, because just like you said, if you ask in your church service at any one time, how many people in this church got diabetes? Everybody gonna stand up. You already see where the obesity is, because you see it walking in the door. But everybody got that. Everybody's on hospital. Most of the people over 50 are on 5 to 6 medications. Come on now. Yeah. So health should be a big part of that ministry, but it's not, because you can't get, can't get the pastors engaged. So that, what can we do?
Well, I know one thing is that I'm thankful for my brother. He's not here just yet, but he'll be here. He has been one that has been very persistent and helpful in it. You have to have a team. It has to be a team of people, because that pastor, he does have a plate full, but I'm so thankful for my ministers and training them and working with them, that when I'm not able to be there, they're there. They go and they represent us at the meetings. They send me back the information, and then we work together, and he works it into my schedule. And he says, well, James, I need you, Pastor, I need you to be here at this function that we're doing at Mercer and the other places. Let's work it into your schedule. So, but we'll cover you here and cover you there. If you're out, we can get this. We'll make sure this is taken care of. That's one of the main things that I see that a lot of the ministers, they're not able to go out and do everything that they'd like to do, because you just don't have the training up under you.
That's right.
That's one thing that the Lord told me when I first started pastoring. He said, train. He said, you gotta train. And I began to train and work with the other ministers. Now, when I have to leave or go somewhere, they step right in and they can do it. So it's going to take a team. That's one of the main pieces to getting them to be a part of what it can be doing, because they're trying to move so many pieces off their plate. But if they got other people that can step in, all right then, or if I can send someone to represent, come back, give me the information, and get them involved. But keep rehearsing that with them and talking to them about it. My brother stays in my ear. Mr. Beard sends out more emails than anybody I know. Almost. He's always out there every morning. I'm looking at another email. Like, boy, this man stays busy. So no, but it has to just keep being consistent. I believe it'll work. It'll work. Get him the help that he needs. Try to get some other things off his plate. Mm-hmm.
Good morning, everyone. My name's Donna Burton, and I wear a lot of different hats within my community. One of which is about 6 years ago, we started noticing some things in our church that we were having some repetitive hospital admissions and things like that. And so I did a little bit of research, and I approached my pastor, who is from Wisconsin. And obviously you can hear from my voice, I'm not from Wisconsin. So I did not realize that what's called parish nursing was a possibility. We did not have it in our church. In the Southeast, it was non-existent. It is not, I'm a Lutheran, but outside of the Lutheran church, it's very prevalent in the Catholic church in the Northeast and in Wisconsin, the Midwest, and things like that. Although it's on the decline in some of the congregations because they don't have nurses who will take the role. So I approached my pastor about it, and I said, you're a great pastor, but you know nothing about the health care of these people. And they're not going to tell you that they don't have money for their medicine. They're not going to tell you that they're lonely and their son's not calling them. And that's why they're calling you 7 or 8 times a week. Mm-hmm. They're not going to tell you things that they will tell me. People tell me anything. They tell me, and sometimes they tell me stuff I don't even want to know. So we kind of researched it and we instituted it kind of slow. Mm-hmm. And it's a part-time thing for me. I have my own healthcare education business. I still work urgent emergent care. not as much as I used to because I'm getting old and it's very hard work. But I felt like my responsibility as a parishioner was to come alongside my pastor with the skills and the knowledge. And I'm a totally different personality from him. He's real nice. And I have no problem with somebody calling him up and saying, Pastor, I don't feel good. Will you come out and pray for me? And it's the 4th time this month. She doesn't feel good. She wants Pastor to come out and pray for her because she doesn't take her lisinopril. And her blood pressure shoots up, and when it shoots up, she gets a headache and she starts feeling bad. And I call her, Miss Etta, did you take your lisinopril? Well, no, because it makes me feel bad. How does it make you feel bad? Which do you feel? When do you feel worse? When you take your lisinopril or when you don't? And I can do that with her. He can't do that with her. So we have come together as a team, and we meet about maybe once every 6 weeks or so, and talk about different issues and how can I help you? And then he in turn says, how can I help you? And it's just my responsibility, just like if I were a carpenter, I would feel like I should help him with repairs in the church. So I have a totally different background. I came out of emergency medicine. I came out of paramedicine when I was really young. There's very little that somebody's going to tell me that I haven't heard before, seen before. And sometimes he sits there in shock because he doesn't know the streets. He doesn't know anything about it. He doesn't. I'm not kidding. He doesn't know about drug use. He doesn't know about a father coming to our VBS to pick up his daughter high as a kite and demanding that we give him his daughter when he wasn't on the sign-off. He wasn't on the sign-off sheet. My 6'4", real nice looking, built like an athlete, pastor comes in and gets me, and I go in, and he says, you want to talk to our nurse? The guy goes, I'm not talking to anybody. I'm taking my daughter. I was like, oh, really? Really? That's what you're going to do? And he goes, yeah. And I said, okay, here's your daughter. And my pastor's standing behind him. And I figure, okay, I think my pastor could take him if he jumped in. But if my pastor couldn't, I could. Okay? So the bottom line was, I took the guy's keys away from him. I told him he had 2 choices. I either call his wife, and she comes and gets him and the daughter, if that's what she wants, or I call the police. Either way. This isn't happening, and it's not happening in my church. Yep. And it worked out, and afterwards my pastor told me, how did you know he was high? I was like, okay. So that's a team. That's the team that I was referring to earlier. So I'm interested in helping anybody that wants to start a parish nurse program.
Yes, because ministry comes in so many different forms. The word basically means to serve. It means to give back. So you can serve in the ministry of helps in so many different areas, and it helps the local pastors to the point where they can make themselves even more so available. And you bring in that information and keep putting it in front of them, letting them see these are the people that are dealing with this, and this is what's happening. That's what's happening. This person is actually going through these situations because of not taking their medicine or not going to get treatment. And we, each year we do the Daniel fast, and the people, they don't like to see that coming. So that's like, anywhere from 14 to 28 days of nothing but vegetables and water. And you can't eat fried foods. You can't eat sweets, any of that. You can't have any of that. But you will be amazed how the people feel once that's over with. You have people each year that said, I'm looking forward to this time of the year because I'm not saying making, but it's encouraging me to be a part of this. I wouldn't do it if it wasn't offered. But because everybody else is doing it, we're going to do it. I've seen people one of my members, he said, watch this magic trick, Pastor. I said, what magic trick? He said, I couldn't button my jacket a month ago. I said, well, you need to keep working that same magic, dear. So, but much better, his health is much better in those situations. We need to, like I said, pastors and churches and ministries, faith-based organizations, we have that capability of encouraging the people to be a part of these things. Not only they're getting blessed spiritually, but they're getting blessed health in their health as well by being a part of these different things.
Mine is not a question. My name is Pat Mercer, and I live in Savannah, Georgia. We have a private practice, so I'm a nurse and also a minister. The parents would come in the store, you know how they're looking up at the doctor's degrees and all of that. Well, the doctor put my degrees up too. So if they came in the office and they had a child with ADHD, they'd say, Miss Pat, could you come in and pray for my child? So yes, we have a ministry in church and outside of church. People know what you do. I never just told people to look up on the wall, but they would come in and they would pass the information on to other parents. They would come in and they want, well, do you think my child should get these immunizations at this age in their, 2 months, 4 months, 6 months, and and so on. And not only that, just family problems. Well, my child is so rude to me. How do you get your child to not talk back to you? I said, first of all, are you doing ministry at your house? That's my first thing. Are you praying in your home? Yeah. You need to know that they are praying. Because you want me to pray with you. I don't want this to be your first experience, but if it is, let's do it. And sometimes I would pray with the parents in the room and then take the children outside of the room, because sometimes you can't do it together. You have to know when you can and when you can't. This is something, as you say, as ministers or as doctors, God gives us all something innate that we know that we can do, and He'll give you the power to do it. And then I would also tell the parents, look, this child is at this age. You can't wait till they get 12 to start disciplining the child. You need to let them know that you're the parent, you're not their friend, and this is the things that you need to do. And I would always, always tell the parents, pray at home with your children. Read them Bible stories. Well, Miss Pat, where do I start? Start where you are. We're doing it right here. Don't be afraid. You're the parent. You're the teacher. You're the person. You're the leader. So everything that we're doing here today, and in fact, my husband was in Africa for 13 days. He got home on Wednesday. He told me yesterday, we're going to a seminar in Macon tomorrow. I said, tomorrow? I said, you just got home. Don't you think you need the rest? He said, no, we're going to get out and go. He said, they have some things for ministry that you can get into too. So I'm so thankful to help whoever pulled this together. Hallelujah. It's encouraging me to do even more in my community.
Definitely.
This is wonderful. Thank you.
Thank you for that. Thank you for the, thank you. Because what she hit on truly is a fact. What you put in the house is what they will eat. If you put prayer in the house, that's what's going to be in the house. And then the same thing with what we do is with food. What you put in those cabinets. Kids say, I won't eat that. If you're hungry enough, if we don't have Oreos in the cabinet anymore, this is what we have in there. This is something that's healthier for you. So same thing with the spiritual realm as spiritual world, as well as with our physical bodies. What we put in our homes, that's what they'll eat. My children, because their friends come over, they say, man, what y'all eat? They say, well, we eat this, we that. Man, we don't eat that. No, he said, no, this good to us. Because they've developed a taste for it. My wife cooks vegetables. They sit there and eat vegetables, and they eating vegetables like it's steak or something. It's like chicken fingers or whatever. Like the other children would love McDonald's or whatever, but they're eating vegetables like that because they've been raised that way, and we've taught that and put that into a part of their diet every day. And diet basically meaning lifestyle. That's their lifestyle now. This is what they do. So those are things, like I said, that the church can teach and preach and share with their church and members, community, and everyone around. Anyone else?
We've got maybe time for one more before.
Hey, I'm Dave Ringer. I'm the family physician and CEO of QHC and Lake Oconee. Acting weird. Just wanted to kind of confirm, I've been there 35 years, and when I first got there, the director of my residency program told me when you open up a solo practice, the first thing you should do is go find all the ministers, talk to them, and offer them free health care. He said, everybody goes through the ministers to find out who the good doctors are in the community. And if the minister is going to that doctor, then and it is a cultural thing. There is, and we found this out in COVID, there's a lot of trust issues with people.
Yes.
And certainly I won't say that some of our fellow physicians, they've had issues through the years of taking advantage of people, but you know, the pastor tends to know the right physicians to go to. Now, I will tell you, I did have some issues early on in my practice, because once you let that out, I didn't realize there were 1,000 ministers in my community. It appears that everybody's a reverend when you let everybody know that. But that was a very good start to building a practice and offering that care and building relationships. So I think that is very confirming of that. The other issue that I've really found is an issue in our community is transportation. It is, I mean, I can say a lot of things, but our no-show rate is like 20%. People want to make their appointments, they want to come, but they can't, either through some crazy family relationships where brothers and sisters charge them $20 to come out of the office, which I see quite often, and I want to hand people $20, to timing. They get the county bus to bring them, but unbeknownst to some physicians, they're 15 minutes late. We're not going to see you today. They've worked their whole day to try to get to that appointment, and they're missing it by 15 minutes, and the doctor cuts them off. So I think sometimes in the rural communities, especially, the providers need to understand that that is a real issue, that they're not just being rude, they cannot get there. So I've found our church and several churches have provided transportation. That is an incredible ministry if you can hook up and tell people, you know, we'll take you to the doctor, because that is, you can have all the services you possibly want in the community, but if the patient can't get there, it ain't helping anybody. So anyway, confirming that.
And that's, like I said, that's definitely a point with transportation. What I found out in ministry as I've gotten older is that as I see the ministry grow, we have people who are retiring. We have retirees now, who now, those are those volunteers. Those are the people that I need to help drive the van, to go pick up the people. So ministry has to always look at that. We're working with the youth, we're building up the future church, but at the same time, the church that's already come through, those people are volunteers now. And you reach out to those people and say, look, well, because many times they say the same thing at our Boys and Girls Club there in Greensboro. We have retirees, teachers, doctors. They're sitting around, they want something to do. So I just don't want to sit here and just, do nothing all day long. So they come and they volunteer. So we have to reach out as pastors to get these volunteers, watching the congregation, seeing as it grows, and you say, okay, she's been sitting there for the last 2 years. We could have been put this person into a position. We just need to have that conversation. They probably wanted to do it, but many times people don't move unless, they're given some type of encouragement or letting them know, you can do this, you could definitely do this, and we'll give you the tools that you need. Because sometimes if you're not careful, you'll have a bus or a van that sits in your parking lot as a pastor, and it just sits there. It's not moving. It's not going out picking up people to bring them to church. It's not taken to conferences. It's just sitting there. We purchased a vehicle, but we're not putting it to work. And that's one thing that we definitely got to continue to work on. That transportation issues, there's many churches around that have the vans and things. We just got to learn. We got to get that organized. Yeah.
When the doctor mentioned the social determinants of health, one of them is transportation, and we see that lagging behind in a lot of low-income communities, and the communities that surround my church are low-income communities. So you look at transportation, housing, education, and employment, and how they impact wellness and health. Oh my God. Oh my God.
Definitely, definitely. That we see the same thing in Putnam County. We have people who, if they had the finances and different other pieces to put there to help them to live healthier, I believe they would be more encouraged to do so. But those are pieces, and those are pieces that we have to, that's why they say we have a holistic approach. It's not just going to be one thing or one piece of the puzzle that fixes it at all. We all have pieces in here. Everybody in here has a piece of the puzzle, and we've got to put our pieces together so we can put the puzzle together and everybody can see the vision. So we have to work on that though. But thank you all. Thank you for your comments.
Thank you. When I said let's have a summit and let's talk about things, I think you took me seriously. Thank you for that. I have good news, and that is the next session we have is over lunch. We'll have some time that we'll listen, and then it'll be about table conversations because there's a lot here. I'm reflecting on a couple of things, and one of them is, if you'll remember when I was speaking earlier this morning about the interviews we've done, we found that physicians did not think that ministers were interested in what was going on in the clinic. And then we found that ministers didn't think physicians were really interested. And what happens when you get together at table and you start developing a relationship? And I love what you said, because it's bringing the ministers in, lets them know they can be in relationship, and it really changes the dynamic. Thank you. I think this morning we have covered how to take your corner of the sheet, how to eat some M&Ms in a good way. We're running a little bit ahead, and that's good. So I'm asking Chris Goggins to come back and cover with us really briefly some of the things you've got on your table. And then we will break until they serve us the meal. The meal should be served at noon, and we will get that meal and then come back. And then I will ask Dr. Deloach to bless the meal after we gather with our food, if that's okay. Chris Goggins, and then we'll have a small break.
Thanks, Paul. As he said, I am the lesser Dr. Scoggins in the room. But I serve as Director of Special Projects here at the Georgia Rural Health Innovation Center, and it's been my distinct honor to work with Paul over the past few years on this project and a variety of other people, and I couldn't be prouder of the work that's been done. And I think the folks who are in this room and the excitement that I've seen today is a testament to that work. What I am here to do, just like Dr. Williams said earlier, is to fill some big shoes. Our Executive Director, Ms. Glenda Grant, is unable to be with us today because she's on her own faith and health journey, and we wish her very well as she recovers over the next couple weeks. But something that's near and dear to her heart and to many of our hearts is sitting right before you on the table. Just like we talked about diabetes, who has been touched by the opioid crisis? I lost a good friend a couple years ago, another one about 8 months ago. Good people, not people who were morally inferior, good people who had injuries, got hooked on pain medication to help deal with their day-to-day lives, to keep going to work, to keep taking care of their families, and lives ripped apart. And I think it's high time that we all pick up our corner of that sheet. And right in front of you is your corner. This is a box of Narcan. It is completely safe. You can't hurt somebody with Narcan. It'll reverse an overdose. It'll save a life. It'll make somebody breathe again. And something that Glenda says every time she talks about this is it's very personal to her because she lost her brother in a very similar situation. And everybody deserves a second chance. And I think if there's anything that we as healthcare providers and faith practitioners can agree upon is that everybody deserves another chance. So I'd encourage you to take this, keep it where you can get to it, because you never know when you'll encounter somebody who needs it. If there's someone in your community that you know could benefit from having this close to them, take it. We have extra if you know of people who need it who aren't in the room. But this is something that's really important to us, and I think we can come together and agree that this is a problem, something we want to destigmatize and we want to fix. I am happy to say that I saw, I'm an epidemiologist by training, so I always look at numbers. The CDC showed that for the first time since 2017, we saw a decrease in opioid overdoses so far in 2024. We are turning the corner on this dark chapter in our nation's history, but we can't take our foot off the gas. So that's why this is sitting in front of you. I hope you will take the time to take that with you and be a part of that solution and take up that corner of your blanket. So with that, I'll turn it back over. Not sure how we're doing on time, but we're pretty close to lunch, and I don't want to stand between you and lunch too much longer. Thank y'all.
Thank you, Chris, and thank you also to the Georgia Rural Health Innovation Center, who is providing this Narcan free of charge for you guys and has enough that you can take some home with you. I believe that it would be amazing that every church in the state has a stock of this, because wouldn't it be great if that was part of saving a life? Okay, so take a break, watch the buffet line, and when food comes, get some, bring it back in here, and then we'll ask our dear dean to bless it after it's served. Thank you, and relax for a few minutes.